school.
So I would get my nails done pretty frequently.
A gel manicure uses special compounds to create a harder, long-lasting nail cover. It requires the use of a dryer that uses ultraviolet light to harden or cure the gel nails.
Just having like that regular like nail polish isn't going to be enough. It might not last as long as you want. It might not look as nice as you want.
It was during one of her frequent manicures that the salon's technician noticed a dark line under her thumbnail.
And I remember my nail tech looking at me and he was like, "Oh, what happened?" And it's like, "Oh, is it a bruise? Like, did you hit yourself or slam your hand?" And I was like, "Maybe, like I must have, I didn't even think about it."
But a week later, she was in pain and her nail looked infected. And when she saw the doctor,
you have to have a biopsy right away because it doesn't look good.
Jasko says on her 18th birthday, she received her biopsy results. Melanoma, the most serious kind of skin cancer, which, if it spreads, can be deadly. A rare form known as acral melanoma.
I just remember feeling numb. I honestly didn't really feel anything.
Jasko underwent multiple surgeries. Doctors removed her thumbnail and grafted skin from her groin to replace the missing skin on her thumb. The cause? Impossible to say for sure. But Jasko says her doctors suspected genetics because her mother had had melanoma, but also her use of those UV nail dryers.
For me, it was very confusing at that time where I was like, oh my gosh, I've been so careful. I've never been in a tanning bed. I always wear sunscreen. And I felt so young and it was confusing.
Her case made headlines and prompted researchers at the University of California, San Diego to study the potential hazards of those UV dryers. What they call a first-of-its-kind study found those UV dryers do, in fact, damage cells and cause mutations typically seen in skin cancer. In the laboratory cells they analyzed, after one 20-minute session of exposure to the UV dryers, it resulted in 20 to 30% of cells dying, while 3 consecutive 20-minute sessions of exposure resulted in 65 to 70% of cells dying. The Food and Drug Administration told us it's reviewing the study's findings, but its current advice is that it views nail-curing lamps as low risk when used as directed. The Trade Association for the UV and Electron Beam Industry, RadTech, said last week that all scientific evidence demonstrates that UV nail lamps are safe when used according to well-established safe practices. Cleveland Clinic dermatologist Melissa Pilion.
If you had your way, would you have patients not use these at all?
I think it's best to not use these at all because we know that they can cause cancer. What we don't know yet is how many times you have to use it, how frequently you have to use it to increase your risk. And some of that we won't know until people have been using